Have you ever caught your reflection and noticed something slightly off about your face? Eyes a little puffier than usual, skin a shade paler, and brushed it off as a rough night's sleep. Most of us would. But what if that small, easy to ignore change was actually the earliest visible sign of kidney failure, showing up on your face months, sometimes years, before any blood test would catch it? Your kidneys are two fist sized organs sitting quietly along your spine, filtering nearly 50 gallons of blood every single day. They remove waste, balance your body's fluid levels, regulate blood pressure, and trigger the production of red blood cells. And despite doing all of that, they almost never cause pain when something goes wrong. Doctors call them silent organs for exactly this reason. Kidney disease symptoms rarely announce themselves with an alarm. Instead, they whisper. And by the time most people notice something is wrong, the kidneys have often already lost a significant share of their function. That's the part that should make you pay attention. The body doesn't stay silent forever, it leaves clues. They just look like ordinary things: tiredness, dry skin, a bathroom habit that's shifted slightly. Today, we're going through the visible signs of kidney failure the way a nephrologist actually reads them one by one, so you understand not just what to look for, but the biology behind why it's happening, and which of these early warning signs of kidney disease are worth a second look. Let's start with the one almost everyone has noticed at some point: swelling, or what doctors call edema. Healthy kidneys keep a tight balance of sodium and fluid in your body. When that filtering system starts to fail, fluid has nowhere to go, so it pools along in the ankles, the feet, sometimes the hands. But the swelling that tends to concern doctors most shows up somewhere smaller and easier to dismiss, around the eyes, usually first thing in the morning. The skin there is thin and loose, which makes it one of the earliest places fluid retention becomes visible to the naked eye. Most mornings, puffy eyes really are just poor sleep. But when it keeps happening, and especially when it shows up alongside the next sign, it stops being a coincidence. Because here's where it gets genuinely interesting. Swelling isn't really about the swelling. It's about what's leaking out of your bloodstream to cause it. Healthy kidneys hold on to a protein called albumin, which keeps fluid inside your blood vessels through a mechanical force called oncotic pressure. When the kidneys filters, tiny structures called nephrons become damaged, albumin starts slipping into the urine instead of staying where it belongs. Less protein in the blood means fluid drifts into surrounding tissue instead, so the swelling you see on your face is really a downstream effect of something happening in your urine, which means the real story isn't on your skin at all, it's in the toilet bowl. And that brings us to one of the most underrated warning signs of kidney disease there is: foamy urine. Not the light, quick disappearing bubbles from a fast stream. Those are normal. We're talking about dense, persistent foam that looks almost like beaten egg whites and lingers long after flushing. That's often a visible marker of excess protein loss, and in many cases, it shows up before swelling does, which makes it one of the earliest physical clues your kidneys may be struggling. Color matters too. Urine that turns cola dark or faintly pink can signal blood. Urine that becomes unusually pale and excessive can mean the kidneys are losing their ability to concentrate waste properly. And then there's a pattern most people never connect to kidney health at all: waking up multiple times a night to urinate, known medically as nocturia. We blame it on drinking water too late, when sometimes it's actually the kidneys losing their normal rhythm of concentrating urine overnight. Now for the sign almost nobody expects: your skin telling a story that has nothing to do with skincare. As kidney function drops, a waste compound called urea starts building up in the bloodstream instead of being filtered out and removed. That buildup, called uremia, can trigger an intense, persistent itch with no rash, no visible cause, nothing a moisturizer will fix. It tends to be worse at night, and patients often describe it as itching that feels like it's coming from underneath the skin because, in a sense, it is. The irritants causing it aren't on the surface. They're circulating beneath it, waiting for kidneys that aren't clearing them fast enough. Skin tone shifts too, but the reason behind it is one of the more elegant pieces of body chemistry you'll come across. Kidneys produce a hormone called erythropoietin, which tells your bone marrow to keep making red blood cells. When kidney function declines, erythropoietin drops, red blood cell production slows, and the result is anemia, which shows up as pale, sallow skin and a tiredness that doesn't lift no matter how much you sleep. This one hormonal thread is what ties together symptoms that look completely unrelated: the puffiness, the paleness, the itching, the exhaustion, different symptoms, same root cause. Which brings us to the symptom almost everyone has and almost everyone dismisses: fatigue that doesn't go away. We live in a culture that treats exhaustion as background noise, something caused by work, screens, or just being an adult. But there's a real difference between being tired because you stayed up late and being tired in a way 8 hours of sleep does nothing to fix. That second kind is worth noticing. It's the combination of circulating toxins the kidneys aren't filtering and the anemia we just covered, and together they create a kind of fog, slower thinking, flatter mood, a sense of running at half capacity for no clear reason. Here's a sign that genuinely surprises people the first time they hear it: changes in breath and taste. As waste products accumulate, some people develop a metallic taste that won't go away, a drop in appetite or breath that takes on a faint ammonia smell, almost like the scent of urine itself. It sounds strange that your kidneys could affect your breath, but the logic is simple. Waste that isn't filtered out doesn't disappear. It circulates through the body, and eventually it shows up in places you'd never think to check. None of these signs live in isolation, and this is where the picture really comes together. Nighttime leg cramps often trace back to imbalances in calcium, phosphorus, and potassium, three minerals the kidneys are directly responsible for regulating. Brittle nails and thinning hair can reflect the same protein loss showing up in your urine. Feeling cold all the time, even in a warm room, can be anemia limiting how much oxygen reaches your tissues. Bruising more easily than you used to ties back to platelet function, which healthy kidneys help maintain. Each one seems unrelated on its own. Together, they start to form a pattern. So, why does this disease stay hidden for so long? Here's the misconception worth correcting. Most people assume organ failure would feel dramatic, sudden pain, and unmistakable emergency. Kidneys don't work that way. They're built with an almost dangerous amount of redundancy, compensating quietly while function drops in the background. It's entirely possible to lose a significant percentage of kidney function before blood work shows a clear problem, and even more before symptoms become impossible to ignore. That's exactly why the visible signs matter as much as they do, not as a diagnosis, but as an early signal, a language the body speaks long before a lab report confirms anything. So, what's actually driving this decline in the first place? Two conditions are responsible for the vast majority of chronic kidney disease cases worldwide: high blood pressure and diabetes. Both are deeply tied to daily life, diet, movement, sleep, stress. High blood pressure slowly damages the tiny blood vessels inside the kidneys, reducing their filtering capacity year after year. Elevated blood sugar does something similar through a different pathway, scarring kidney tissue gradually, often over decades, without a single noticeable symptom along the way. This is the real meaning behind calling kidney disease silent. It's not that nothing is happening, it's that the damage accumulates quietly, invisibly, until it crosses a threshold the body can no longer compensate for. And daily habits feed directly into that threshold, more than most people assume. Chronic dehydration forces the kidneys to work harder just to concentrate urine, adding strain over time. Frequent, heavy use of certain over-the-counter pain relievers has been associated with reduced kidney function in some people. Diets high in sodium, the kind baked into most processed and packaged food, raise blood pressure, which indirectly stresses the same blood vessels the kidneys depend on. None of this means one bad week ruins your kidneys. The body is far more resilient than that. Risk here isn't about a single decision. It's about which patterns repeat week after week, year after year, without you noticing. What makes the kidneys such a fascinating case study in human biology is how far their influence actually reaches. They regulate blood pressure through a hormonal pathway called the renin-angiotensin system. They convert vitamin D into the active form your bones actually use. They keep your blood's pH in a narrow, life-sustaining range. Once you see the kidneys not as one isolated organ, but as a control center wired into your blood, your bones, your hormones, and your skin, it stops being surprising that their decline produces symptoms in places that seem to have nothing to do with kidneys at all. This is also exactly why early detection of kidney disease relies on more than symptom spotting. A simple blood test measuring creatinine and estimated glomerular filtration rate, paired with a urine test checking for protein, remains far more reliable than any visible sign on its own. The signs we've walked through today aren't meant to diagnose anything. That's not their job. Their job is to make you pay attention, to turn a puffy face, a stubborn itch, foamy urine, or fatigue that won't lift into something worth mentioning to a doctor, particularly when several of them start showing up together. There's something worth sitting with here beyond the biology. So much of modern life trains us to override what our bodies are telling us, push through the tiredness, ignore the itch, explain away the puffiness, but the body rarely sends a signal without a reason behind it. Somewhere underneath the fatigue, the swelling, the itch you can't quite explain, there's often a story being told in the language of biology long before it ever reaches the language of a diagnosis. So the next time you notice puffiness around your eyes that won't go away, or urine that looks different than it used to, or a tiredness sleep doesn't seem to touch, pay attention. Your body has been talking the entire time. The only real question is whether you've been listening.